Will COVID-19 vaccine affect my child long term? After all, most children have very mild symptoms, right? Hi, I'm Dr. Vidya, pediatrician and neonatologist of more than 25 years experience, and I'm passionate about childhood vaccines. So COVID-19 vaccines for children more than 5 years old has been around from February 2022. It is safe. It should be given to all children in Malaysia as soon as they turn 5. So COVID-19 infection can cause children to end up in the ICU. But more than that, what happens to children after a few weeks of not being well? They get to be even more sick with something called MISC. MISC stands for Multi-System Inflammatory Syndrome, and this is a relatively new condition that we are beginning to see with children with COVID-19. So after they recover from an illness with COVID-19, they appear well for a couple of weeks, maybe even a month, and then suddenly have high fever and look very, very ill. And they can present with anything because it is a multi-system issue. So they have tummy pains, diarrhea, vomiting, fever, sometimes have breathlessness and even can't fit. And a lot of these children end up being very, very critically ill, needing ICU care. Besides MISC, they also are, just like adults, prone to get what we call long COVID syndrome. All right, so they feel lethargic, might have a cough that goes on and on for months and months together, just like adults. Besides this, COVID vaccines are very important in children because they are going to be carrying these viruses around them and they're going to be infecting our dear and near loved ones, especially the ones who have got a little bit reduced immune system, like babies and older adults, like grandparents around us. COVID-19 vaccine in children will and may have mild side effects. Basically, maybe a little bit of lethargy, maybe a bit of soreness at the site of injection, maybe some low-grade fever. But most of the time, the children take the vaccine very well. They might have something a little bit more concerning, with which you might always see your pediatrician for some support. So sometimes, very rarely, children might have more severe side effects, like basically headaches, maybe abdominal pain, maybe lethargy. They might have vomiting and diarrhea, just like any other vaccines that children get. So very, very rarely, children do develop an allergic reaction to the vaccine, where they might present with swelling around the lips, the eyes, maybe difficulty in breathing, or they might have maybe a heart condition that makes them breathe fast. All these symptoms, if they do occur, you need to go to the hospital as soon as possible. Just a note that there is definitely no evidence to even suggest the possibility that children who are vaccinated will not be able to conceive as adults, or if they will ever have any fertility issues. There's no evidence at all. Rest assured, moms and dads, COVID vaccine is imperative. It does not cause any long-term effects for your child. Please get one as soon as your child turns 5 to protect yourselves and your loved ones. Hi, I'm Dr. Vidya, and if you like what you heard today, please like and share the video.